Most of us are aware of the classic symptoms of heart disease. But we often fail to make a connection between certain conditions in other parts of the body and heart problems. Unhealthy blood vessels can show subtle early warning signs that often go unnoticed. So don't wait until it's too late. Start paying attention to these red flags and take action to protect your heart health today. Number 1. Fragile toenails that grow slowly. The capillaries under the nail bed require oxygen-rich blood for healthy nail growth. When blood vessels become narrow, due to atherosclerosis, a buildup of plaque on artery walls causes restricted blood flow. As a result, the toenails can become brittle. Nail texture and color can change and they grow slower than before. Number 2. Claudication calf pain while walking. This can indicate peripheral artery disease PAD due to atherosclerosis and blockages in leg arteries, particularly in undiagnosed smokers with no history of coronary heart disease (CHD). This symptom should be evaluated urgently. Poor blood circulation is confirmed by pulse examination and measurements of blood pressure and blood flow in the legs. Patients may experience toe-to-calf cramps while walking and in physical activity. Additional signs include shiny skin on the lower limbs, skin color changes on the legs, leg and foot ulcers, and numb or weak legs. Number 3. Erectile dysfunction. Erectile dysfunction can be an early warning sign of obstruction of arteries in the pelvic area. This may eventually lead to a heart attack 3 to 5 years down the road. To avoid the disastrous but preventable outcomes, in this case, it is justified to conduct a comprehensive evaluation for an underlying heart condition. However, the current medical practice often involves prescribing erectile dysfunction drugs without taking the risk of coronary heart disease into account, which needs to change. Number 4. Loss of hair on the legs and feet. Hair loss on the legs and toes can be a symptom of silent CHD caused by reduced blood flow due to atherosclerosis in the leg arteries. The hair follicles require a good supply of blood, carrying oxygen and nutrients for healthy growth. However, when the tiny blood vessels that feed them become damaged or narrowed, less hair grows or falls out. Although this symptom is frequently disregarded, it can act as a warning of underlying cardiovascular disease. Number 5. Balding crown. Silent CHD can be strongly foretold at any age by severe hair loss around the top of the head. Number 6. Hair graying. The biological processes that result in atherosclerosis and hair thinning may be related. According to the experts, 545 adult men who had never had heart disease were enrolled in the research to find any undetected cardiac blockages. A CT angiogram was performed on the patients. It was discovered that people who had mostly gray or mostly white hair had a higher chance of developing silent cardiovascular issues. Number 7 is Frank's sign. Do you know that your earlobes may be conveying important information to you about the condition of your heart? An oblique fold in the ear that extends diagonally from the ear canal to the bottom edge of the earlobe is referred to as Frank's sign. Research has linked it to an increased chance of stroke and silent CHD. Number 10. Sitting 10 or more hours a day. You are more likely to experience a heart attack and other health problems if you spend 10 or more hours per day sitting down. Pay attention to how much time you spend sitting down, particularly if your job is sedentary. By getting regular exercise, standing and moving around for a few minutes every hour and avoiding prolonged sitting, you can lower your chance of developing these conditions. Number 9. Restless leg syndrome, RLS. RLS is a neurological condition that makes people feel the desire to move their legs. Constantly itching, tingling and burning sensations in the legs are typical RLS symptoms that can get worse at night. There is no clear link between coronary heart disease and restless leg syndrome. However, some research indicates that people with RLS may be more susceptible to circulatory conditions like CHD and stroke, though the precise causes of this relationship are unclear. It is believed that RLS may be connected to other CHD risk factors like hypertension, diabetes and obesity. Therefore, it may be wise to consult a healthcare professional if someone has RLS symptoms to determine their absolute cardiovascular risk. Number 10. Psoriasis. Even if they don't have any other risk factors, people with psoriasis are more likely to experience a heart attack. Inflammation brought on by psoriasis can harm blood vessels and cause plaque to accumulate. Heart attack and stroke risk have long been related to chronic inflammation. It is also important to look at the medications you are using to treat your psoriasis symptoms. TNF-alpha inhibitors and methotrexate may lower the chance of heart attack, whereas some interleukin inhibitors and other psoriasis treatments can raise the chance of heart attacks by altering cholesterol levels. Number 11. Hyperthyroidism. New research has found that higher levels of free T4, a thyroid hormone, may be linked to an increased risk of atherosclerosis and cardiovascular events, independent of known CHD risk factors. More high-grade coronary stenosis plaque burden and high-risk plaque characteristics were found in patients with subclinical and overt hyperthyroidism than in patients with normal thyroid function. This suggests that a rise in thyroid hormones may contribute to coronary vascular degeneration and plaque instability. Hence, measuring thyroid hormones could help identify those at risk and prevent future cardiovascular issues. Number 12. Gum disease. People who have gum disease are more prone to experience a heart attack even if the other risk factors are not present. Gum disease that is active and causes swelling and inflammation has a high positive predictive value as a risk for heart attacks. It is very important to maintain good oral hygiene with regular brushing, flossing, and trips to the dentist. Heart disease is a silent killer that often goes unnoticed for years. About 50% of the adult population has some sort of heart or blood vessel disease that they are unaware of. Patient education, early detection and timely intervention is the difference between life and death. If you notice any of these symptoms or have any of these early mentioned conditions, you need to talk to your doctor about your health. Check. If you are above 50, you need to get serious about your heart health. Watch this video next to manage your risk factors and get into heart-healthy eating habits. Thanks for watching.